I would argue that one of the strengths of the program is where our clinic is actually located. We're currently at Family Care Health Centers and located here in Carondelet neighborhood of South St. Louis. It's predominantly where most of our patients live, and I think that's uniquely important because we have our ear to the ground in regards to the needs of our patients.
I really like when I interview for family medicine programs, the one thing I really liked about SLU program was its focus on urban underserved community. The population that we serve is diverse. We have people, definitely our refugee population. We have a huge Hispanic Latinx population. Of course, our Black community. So even, right out the back in residency, you get that experience of working with different cultures, different backgrounds, ethnicities.
Choosing a program for residency, I think it's exceedingly important to find a space that will allow you to develop the skill sets that you foresee yourself using in the future. For me, that's underserved care. And what I started to recognize is you had to follow the money. Essentially figuring out where a program was placing their outpatient clinic really spoke to whether or not there was a big commitment to underserved care. SLU both talk the talk but walks the walk by putting our residents here at Family Care Health Centers and directly within the community that we serve.
I also thought that the curriculum, the urban underserved curriculum, really helped to get you to know St. Louis and some of the issues that our patients may go through. Homelessness, working with those with intimate partner violence, child abuse. Those are some really good topics that medicine itself, in medical school, doesn't really prepare you too well to deal with the trauma that some patients can have.
Typically when I think of underserved care or federally qualified health centers, I tend to think of resource poor and somewhat limited in that sense of what you can kind of give to your patients or provide your patients with. And what I have found throughout my residency is this safety net that really allows you to walk home at the end of the day feeling as if you did your patients justice.
I think as a pediatrician in a federally qualified health center, I am getting to practice public health at the micro level, really at the individual level. So many of the programs that we have here serve to provide wraparound care to our patients.
And one of the things that I think Family Care does uniquely well compared to other programs is the resources it provides its physicians to do comprehensive and holistic care. We have a community health department that assists individuals with anything from grocery bills to utility bills to finding housing or finding support groups out in the community. We have an integrated behavioral health model.
Because behavioral health care is so intertwined into the medical care of family care, it's also very intertwined into the training through the residency. And so when residents start their continuity clinic here at Family Care, on that first day you have behavioral health consultants available to you, and I think residents feel really supported when they come here and are seeing lots of these complex patients with trauma and all these other mental health and behavioral health, substance abuse issues, and how they can easily call on one of the behavioral health professionals and get that support and collaboration in treating and co-managing their patient and the care that they're receiving. I think Family Care is like no other place in that way.
Currently, we're kind of evolving out our pain management group. So we have acupuncture, physical therapist, a chiropractor, doing a lot of things that I think allow you to expand the value of that 20-minute visit.
I definitely incorporate addiction medicine into my practice as well as pain management. And I felt the residency program prepared me for OB, specifically those with substance use. We do a lot of other high-risk pregnancy care with management of, IUGR, intrauterine growth restrictions, and so forth. Family medicine is pretty exciting that, I still get to get those interesting clinical cases. Definitely full scope family medicine. The addiction medicine part is new. So I do provide, treatment for substance use disorder, and I think it's really huge.
So our patients are able to get cutting-edge kind of pharmaceutical care. They're able to get care in regards to physical therapy that many other patients that don't come to a federally qualified health center wouldn't be able to get. So our program is smaller in the sense that it is 6 residents per class. I think the smaller class for us gives that environment of you're going to get to know one another pretty well, but also you're going to have more intimate interactions with your faculty.
Don't be afraid to talk to your attendings, to talk to your mentors.
Faculty were always very approachable.
Just about everybody who works here absolutely loves what they do, and so if you have an interest in whatever one of us is doing, whether that's medically assisted therapy, whether it's the Reach Out and Read program that we do for our well child visits, whether it's palliative care, there's just so many aspects to family medicine. If you have something that you like to do, we can try to make it happen.
The culture of this program is definitely welcoming of all different backgrounds. That doesn't matter to the program, and it's a family when you come.
What we do here is unique in the sense that we try to give you a platform to best succeed. So throughout the month of July, you will get acquainted with members of our staff, both here and at the hospital that we work at. In addition, you'll have kind of training sessions around our EHRs, how to go about getting referrals accomplished, and just better learning our systems. What that allows you to do is A, get acquainted with your class, get acquainted with faculty, but also develop a sense of kind of ease and a lack of anxiety as you kind of progress towards your first day of doing clinical medicine.
This may seem cheesy, but you know, family care has really become a family for me. The work environment is extremely supportive and collaborative, and it's not competitive, but we're all working together for a common mission of treating and providing excellent patient care to our community. And I think that unites us, and yeah, so we're a family.